around you, make sure they know to cover their cough.
Hi, I'm student nurse Jelong. Today, I'm going to show you how to do the drug reconstitution. Also, I will give this medication through piggy bag.
So if any of that happens, make sure you
wash my hands
call
first.
myself or another nurse over. And so we're going to administer.
I received the doctor's order, and this is my mark. I have the patient Susie Sanchez, 45-year-old female, and she has no known allergy, and she is admitted for her UTI. Doctor gave her the ciprofloxacin 1 gram, IV every 8 hours. Okay, and then now the time is 15:45. I have my medication 750 milligrams vial powder medication, and I checked the date, it's not expired, so it's good. And also I look at the monograph. It says I'm gonna add 8 ml of sterile water into the powder. So I have my sterile water here. So I'm gonna mix the water with the drugs. I have the 10 cc syringe, and also I have the needles.
Before I attach, I'm going to inspect the IV site, make sure there's no encephalitis, and it looks fine, so we can start that. Attach it to
Okay.
the cap's off, so we can start
Sanitize the top
and the doctor ordered the CE set to
for 30 seconds.
over a normal
Let
rate.
it air dry for 10 seconds.
I'm just going to stay here to see, make sure that it is running.
And then I will draw 8 ml of air and inject it into the valve.
And it is running now.
Make sure there is no air bubbles.
Now I've been starting administering medication, so I would sign my card saying that I gave my medication, and I'd like to come back
And do the same thing.
20-ish minutes to evaluate how the medication went, if there was any concerns with the medication, how he tolerated the breathing, if his breathing improved, and also I would come back and administer 3 milliliters of normal saline to ensure all the medication has gone through, and also note in my IPN if there is any concerns with.
So I have my sterile water. Now I'm gonna put it into my powder jug.
11 minutes.
11 minutes.
No, this is not running.
And let air out.
Because this is on, I think.
Okay.
The alarm is on.
Same thing.
Oh, you're right.
I'm gonna gently roll it to make sure it's fully dissolved.
I think you can actually like manage.
I'm going to do it again.
Do it again. Do it again, but like worst case scenario, that's what you
And the monograph.
We'll start yours right
The monograph says I have to dilute it into 50 ml normal saline piggy bag, and the final concentration of this vial is 90 milligram per milliliter. So I did my calculation, so I have to draw 11.1 ml from the valve. So I'm gonna use 2 syringes because the syringe is 10 ml, and I need 11.1 ml. I will draw 5 from this one and 6.1 from this one.
I have no idea.
It's not real life.
Is that real life?
I almost forgot to check for the.
Hold on, so I can use just 1 syringe for mine?
Yeah, I used one. Both is 2 more work.
No, because I don't. How many we have left? Oh, geez. Okay.
So 6.1 from here.
If I were you, I would
What?
have these sleep for if anything, worst case scenario, you literally have two things you can
Okay.
do with this. If
Mm.
the problem,
I have my mini bag
and
here,
you didn't wash your hands.
50 mils normal saline, and I'm gonna sanitize the port
Not even joking. Like that's I saw your whole thing. That's my opinion.
for 30 seconds and let it air dry for 10
I don't know.
seconds.
Maybe she would. Maybe she would.
She took them.
So I'm gonna inject this one here. Yep. For the first. And I'm gonna have the second one inject.
I did a sort of final, like, but I would use a lot of.
And so I have this mini bag
I'm
ready.
gonna do it again, obviously.
When I'm done with the bags, I'm gonna gently mix it.
Did you
And
put the monograph?
also I'm gonna label it
Because I didn't. I don't
with
know.
all the information here.
It was in there.
Was it in there?
Cause I actually
Okay.
put the page.
So
Oh, okay.
before I'm entering the patient's room, I'm gonna do the second check and sanitize my hands as well. So I have the red patient, I have the red medication, I have the red dose, 1 gram. I have the right time of frequency and the right route IV. I need my tubing and hooks. I need my alcohol swabs and my drugs, and also I will take my more. Knock knock and safety check. The bed is locked and everything's safe. The people is not feeling any discomfort. Introductions. Hi, my name is Jelong, your student nurse. How are you feeling, Mr. Sanchez? Mrs. Sanchez? Could you tell me your name and date of birth? Okay. And today I'm gonna give you a medication for your UTI to reduce the inflammation. And if you experience any nausea and vomiting, this is a normal side effect. If you experience any severe discomfort, you can let me know, okay? And you have the cowbell in reach, so you can just pull the cowbell. And I'm doing my third check at the patient's bedside. I have the right medication, which is ciprofloxacin. I have the right dose, right time, at the right time and right route, right time and right dose. I will do the priming first. And I have the tubing here. And I check this is normal saline, which is compatible with my drugs. I will use this port close to the bag, and I will sanitize it first for 30 seconds and 10 seconds air dry. Open this port and connect it. So the water, I open the clamp, the water starts to come up. Okay. So when it's about half of the chamber, I'm gonna close it. Okay. Make sure there is no bubbles in the air and no kink. I have my bags. I have I have the cap. Remove the cap and remove this cap too, and just connect it. Okay, and now it's set. And I will hang this one higher and use the hook to hang this primary line lower. When I'm done this, and I can just open the clamp and set up my pump. So I will set up the second one. I calculated the flow rate is 100, should be 181, and the volume is 61.1. So I will confirm the second line and let it start. And now it's running and at 181 mils per hour. And after this, I'm gonna document the patient tolerance, the patient's like what time, the time, the dose, the medication, and the date, and my initials. Also, I will put a label on the tubing, and to let them, let my coworkers to know that when did I administer. So I will come back, Mrs. Sanchez. I will come back to check your allergies or any discomfort in about 15 minutes. And also I will monitor your vital signs to make sure that everything goes well. Thank you so much.